A very good morning to all. Thank you, ladies and gentlemen, for joining the obesity program, Obesity OBEFIT webinar hosted by RAC Hospital and Arabian Wellness Center. Today, we are here to discuss a topic that is obesity, a health crisis. And I take this privilege to introduce our today's speaker for webinar, that is Dr. Hala Yusuf Hamdi, our specialist consultant endocrinologist, and who is the head of the department of our endocrinology department in RAC Hospital. Dr. Hala did her medical degree in 1987 and she did her MRCP in 1999. She's an endocrinologist and she holds more than 30 years of experience in this field, and she has served in countries like Egypt, Kuwait, and the Middle East and the United Arab Emirates. She So she is expertise and she provides a comprehensive patient care with diabetes and manages endocrine disorders. And she is specialized in preconception care for women with diabetes, management of gestational diabetes is her expertise with pre-existing diabetes during pregnancy. She also manages and expert in diabetes comorbidities management such as hypertension, dyslipidemia, and obesity. She's also manages in the thyroid disorders, including hypothyroidism, and thyroiditis, inclusive of pituitary disorders, metabolic bone diseases, and many other disorders. And she has been in RAC Hospital for a quite long time. And she is today going to enlighten us with obesity, a healthcare crisis. Over to Dr. Hala for us to listen to your talk today. Thank you.
Thank you, Dr. Nietzsche, for this introduction.
Doctor, you can put your slides on the presentation mode. Yes, thank you so much.
Okay, we'll talk about today overweight and obesity. Really, it is a global epidemic, and we call it now the globesity. It is a risk factor for many health problems, and what we will talk today about is the health crisis. It precipitates many health problems, as we'll see in our talk. Now, over 1 in 3 adults Emirati are suffering from overweight and obesity, and 1 in 4 adults are living with obesity in the UAE. Nearly 40% of their children are living with obesity or overweight. The deaths also are increased because of this health problem. So what is obesity? Overweight and obesity is a condition characterized by excessive accumulation and storage of fat in the body. We calculate it by what we call the body mass index. The body mass index is calculated by the weight in kilogram divided by the height, square height. And the number which comes reveals what is the grade of obesity or overweight. So the normal BMI is from 18.5 to 24.9. Overweight is 25 up to 29.9. Above 30 is considered obese, and above 40 is considered morbid obesity. Overweight and obesity, they increase the risk of many health problems, especially if you carry extra fat around your waist. The waist circumference, this is a better estimate of the reflection of the visceral fat. We mean by the visceral fat, the dangerous internal fat that coats your organs. The waist circumference, if it is more than 102 centimeter in men, or in women more than 88 centimeter, this is our risk factor for developing the health problems. So not only the BMI, but also the waist circumference is a very important indicator of precipitating the health risk problems. Obesity is not just a cosmetic concern. Many ladies who come to our clinic, the only concern is their cosmetic and their how they will be able to be more beautiful. No, it is not this what we concerned about. We concern about as a medical problem, which increases the risk of many other diseases and health problems, as we will see in our talk. As we see here, every organ in the body is affected by the obesity. Type 2 diabetes mellitus. In 10 people suffering from diabetes type 2, 9 of them are overweight or obese. As we know, type 2 diabetes leads to heart disease, to strokes, kidney disease, eye problems, nerve damage, and others. So if you are at risk of diabetes, having a family history of diabetes, having a polycystic ovary disease, you may be able to prevent or delay diabetes by losing 5% to 7% of your weight. High blood pressure. Hypertension. Hypertension is a condition in which the blood flows through the blood vessels with a force greater than normal. So if you are obese, the blood pressure is increased because the heart needs to pump harder to supply blood to all your cells. High blood pressure can strain the heart, damage the blood vessels, and raise your risk of heart attacks, stroke, kidney disease, and death. Losing enough weight may lower the high blood pressure and prevent and control related health problems. Many patients who lose some of their weight, we stop their antihypertensive medications because their blood pressure becomes normal. Heart diseases. These describe the health problems that affect your heart, such as heart attacks, heart failure, angina, or abnormal heart rhythms. Having overweight increase your risk of developing high blood pressure, high blood cholesterol, high blood glucose, and all these are risk factors for developing the heart problems. A stroke. We mean by a stroke, a blockage or a rupture of the blood vessels of the brain. A stroke happens when this blood vessel is either blocked or bursts, and a stroke can damage the brain tissue and make you unable to speak or move part of the body. Overweight and obesity can lead to hypertension, and hypertension is the leading cause of stroke. Breathing problems. The obstructive sleep apnea. During sleep, the gravity and the muscle relaxation allow the tongue and the surrounding soft tissue to fall back into the throat area, obstructing the airflow. So your upper waist becomes blocked, causing you to breathe irregularly and even stop breathing altogether for short periods of time. This leads to low oxygen tension in the blood. So untreated sleep apnea may raise your risk of developing heart disease because of this hypoxia. As you are obese, you have more stored fat around your neck, making airways smaller, which can make breathing difficult or cause snoring. Many people with obstructive sleep apnea, they do not know that they have it. They always come complaining of fatigue and that they always feel sleepy at daytime because their quality of sleep at night is not good because it's always waking up or shallow sleep. And if you ask them, yes, they are snoring usually. So losing weight may help reduce this sleep apnea. Asthma. Asthma is a chronic condition that affects the airways in the lung. If you have asthma, you may feel wheezes, cough, or feel chest tightness. Obesity can increase the risk of developing asthma. And if you lose some weight, the asthma usually improves. Fatty liver disease. This is now a very common issue. Every patient coming said, I have a fatty liver disease. We mean by the fatty liver disease, it develops when fat builds up in your liver. This can lead to severe liver fibrosis, cirrhosis, or even liver failure. People who are obese, overweight, they have insulin resistance, they have high lipids. Losing 3% to 5% of their weight may reduce the fat in the liver. As we see here, there is a normal liver, then fats starts to accumulate, and this is what we call the steatohepatitis, and then fibrosis develop, then later on cirrhosis, and maybe even in 2 to 3% hepatocellular carcinoma may develop. Osteoarthritis. This is a common, lasting health problem. It causes pain, swelling, stiffness, and reduced motion. Obesity is a leading risk factor for osteoarthritis of the knee, the hip, and the ankles. And these are the weight-bearing joints. So even if the knee is the problem and we try to replace the joint, this is not the end, because without losing the weight, it will recur again. Gout. Gout is a kind of arthritis that causes pain, swelling, and redness in your joints. Gout develops when crystals of uric acid build up in your joint. Risk factors for this condition is being a male, being obese, and having high blood pressure, and consuming food high in high purines, like red meat. Also, there are many cancers associated with overweight and obesity. Men with overweight and obesity are at higher risk of developing cancer of the colon, rectum, and prostate. Females with overweight and obesity are at higher risk of developing cancer of the breast, the uterus, the gallbladder. Diseases of the gallbladder and the pancreas. Overweight and obesity may raise your risk of getting gallbladder diseases, such as gallstones and inflammation of the gallbladder, which we call cholecystitis, which causes severe pains and vomiting. People who have obesity may have higher levels of cholesterol in their blood, and so this can cause the gallbladder stones. Obesity can also affect your pancreas, a large gland that makes insulin and enzymes to help you digest the food. So people who have obesity have a higher risk of developing inflammation of the pancreas, which we call pancreatitis. Also, the high triglycerides, which are part of the lipid, if it is very high, this also precipitates the pancreatitis. So you can lower your chance of getting pancreatitis by sticking with a low-fat, healthy eating plan. Kidney disease. Kidney disease means your kidneys, as we know, are damaged and can't filter your blood as they should do. The obesity raises the risk of diabetes and high blood pressure, and these two conditions are the most common cause of the chronic kidney disease. So losing weight may slow the progress of the disease and keep your kidneys healthy. Pregnancy problems. We face this in our clinic when pregnant women with obesity came. They have a greater chance of developing gestational diabetes, having preeclampsia or high blood pressure during pregnancy, which can cause severe health problems for the pregnant women and the baby if left untreated. Also, they will need mostly a cesarean delivery as a result of taking longer to recover after getting birth. and gaining more weight or continue to have overweight or obesity after the baby is born. The baby himself, if the mother having obesity, this also can increase the health risk for the baby, including being born larger than expected, developing chronic diseases as adults, including type 2 diabetes, obesity, heart disease, and asthma. Obesity increases the risk of developing infertility. In women, they have higher incidence of high insulin resistance and polycystic ovary syndrome, and losing 5% of their body weight may increase their chances of having regular menstrual periods, ovulating, and becoming pregnant. Also for men, obesity is linked to lower sperm count and sperm quality. The mental health problems. Obesity can also affect the mental health, increasing the risk for developing long-term stress, body image problem, low self-esteem, depression. Depression also may lead to eating disorders. They cannot stop eating. They have much craving. They know that they are, and they feel always guilty that they are eating more. Losing excess weight has been found to improve the body image, the self-esteem, and reduce the symptoms of depression. It is not only the health crisis, but also from the economic part. There are medical costs and non-medical costs. Medical costs because of they are going to the hospital, they having visits, they having some medicines, if they are treating the health risks which develop obesity. Also, like the people with obstructive sleep apnea, they are less productive. They don't go to work every day. They feel sleepy, they feel tired, they feel fatigue. And there is also incidence of the premature mortality. So there are really many economic costs for obesity. Obesity is not only a risk factor for other diseases, it is a complex, relapsing, multifactorial disease. It is not like a flu, which you will take some antipyretics and it will be okay. No, it needs always treatment and follow-up of our instructions and advice. These people that they are obese, because it is not only the food. There are many other factors driving their obesity. Blaming them, no, you are not eating healthy, this is not only the cause. There are genetics, and there are environment factors, like how they sleep, how they eat. Commercial factors play a great part. Always the advancement of unhealthy food is there, encouraging people to eat these foods. The healthcare access and the mental health are all many drivers for this obesity. The people should be encouraged to seek medical care. Increase the access to treatment for all that need. And now the treatment is not covered up till now by the insurance for the obesity. And it is a very costly medicine, and it needs to be continued for long periods. We should encourage faster investment in obesity research and improve also the education of the health professionals to prevent and manage obesity. Thank you.
Thank you, Dr. Hala, for this wonderful presentation and for enlightening us with so much of information, very informative. Now, can I call Dr. Wilku to address any questions?
Yeah, thank you, Dr. Nitya. Thank you, Dr. Hala, as usual. Wonderful presentation with the straight illustrations and everything. Yes, we got few questions. Even I'm getting more questions, and we have stored some questions from the weight loss challenge first day event also. Okay, one question being asked from Orhan. Now, this is very interesting. Dr. Hala, you might be facing many times, and we are also coming across this Munjaro every time during during the weight challenge, weighing the first phase of weighing. People were asking, "What about Munjaro? If people are using Munjaro?" So there are a lot of questions. So Orhan has asked, Munjaro is becoming popular for weight loss. Some doctors say it's not good. Still, it's available on purchase. What are the side effects?
Okay. The side effects of Monjaro, mainly the patient may feel some nausea as it acts by reducing the GIT movements. So you feel always bloated or sometimes severe constipation. Some vomiting may be there. Also, the severe side effects, which at that time we advise the patient to stop it, it is very rare to develop pancreatitis. If the patients have a history of medullary carcinoma of the thyroid, at that time, we advise him not to use the Monjaro, because there are some studies, it's not in the human, but still that it said that it increases the incidence of medullary carcinoma of the thyroid. So if there is a family history of this type, special type of thyroid carcinoma, it is contraindicated to give it to the patient.
Yeah, that's the reason. The best way to use, if you are trying to use Mounjaro, please consult your doctor and let doctor prescribe you, because doctor knows ins and outs of the medicine. So that will be the best way to use it if it is required. Now, second question is, there are many medicines. Given then, this is also very common question. There are many medicines available to reduce hunger and burning fat. Is it good for health?
See, we usually use the FDA approved. If this medicine is FDA approved, some medicine are for short periods and some medicine for long periods. But we should, some contraindication, we should know what is the medicine, how it is going, is the patient hypertensive or not, because some drugs also have increased incidence of suicidal thoughts. So we have to be very careful with these medicines.
Yeah. Yeah. And Tanusha has asked, if someone with subclinical hypothyroidism do intermittent fasting regularly, and can I take my thyroid medicines and still do 1 day liquid fast for cleansing? And the second part of question she is asking, should we do intermittent fasting according to the phases of menstrual cycle? Two questions connected.
Yeah, it is no contraindication to do intermittent fasting if you have hypothyroid, because you are taking the medicine and no problem, you can do the intermittent fasting, no problem. For the menstrual cycles, yes, we can. It's according to the intermittent, we are doing it every day, or you are doing it, some people are doing twice a day, twice times a week. So it is related to what you feel, nothing mandatory.
Yeah, true. And what about, because even last many times, and even last two webinars, the previous webinars, we have come across two main question. One is PCOD and second is the thyroid problem. So it makes the individual little difficult to reduce the weight. And they are concerned, is there any specific management for diet and exercise along with the medication? And what is your suggestion, Dr. Ala?
Well, for the
For PCOD
hypothyroid,
and as well as thyroidism.
for the hypothyroid, if the patient is, the TSH is controlled and she is not losing the weight, so there are other causes, not the hypothyroid. Because if the hypothyroid, the TSH is well controlled with the medicine and she is not losing the weight, then there is something else, not the hypothyroid issue. So she has to do the diet or the exercise, and if the BMI is very high, then maybe she will use some medicines to help her. So it was not the issue of the hypothyroid, because if it is controlled, so there is other issues playing a role. For the polycystic ovaries, as we all know, that these conditions, she has insulin resistance, and it is hormonal issues are playing, and because of that, sometimes, which is off-label, we give the metformin to reduce the insulin resistance. And now they found that the polycystic ovaries, with the new medicine for reducing the weight, they are giving very good results in polycystic ovaries.
Yeah, true. But again, everyone should consult the doctor before going into any medication part of thing. Nikita says she's concerned. She is diabetic. She is overweight, and she has moles on her body. She has done kidney function test and liver function. Everything is normal. And is it related to her question is the moles related to her weight or not? And she's
What do you mean?
diabetic.
Moles? Moles, you
Oh,
said?
she's not diabetic, sorry. She's not diabetic and she doesn't have any medical complaints. Only obesity. Is it related to weight?
I don't know. I have to see the lesion itself, how it looks like. If it is moles only, then she has to consult first the dermatology to see what is going on here. But if she is diabetic, yes, we have sometimes diabetic dermatosis, which causes these pigmentations.
Yeah. Femina has asked, are weight loss injections effective? Again, everyone is concerned about their weight loss, but they don't want to go into a standard lifestyle protocol. They want an easy shortcut quick fix. Is injection effective for weight loss?
Yeah, this is the problem. The people think that these injections are the magic. They can eat whatever they like and take the injections. And this is not the story. You have to have a lifestyle modification, and this is for life. With the injections, the injection will push you. But if you are eating whatever you like when unhealthy, even the injection will not work. So both are going with side by side.
Yeah, true. Uh, just now I received one question from in my WhatsApp. Somebody from they don't want to open their name, but question is liposuction is very commonly advised for a fat loss. The patient is diabetic. Will it help me to reduce my diabetes, control my diabetes also? Liposuction.
No, liposuction will not, it is not playing with the hormones at all. And usually it is for specified part of the body which is having some problem, they do the liposuction. But for the diabetes, no, it is not working with the diabetes. It will not help you to control it.
Oh, great. And there is one more question which I was looking, just one second. Yeah, this is very unusual question we come across because when a diabetic person goes to a doctor and doctor prescribes a metformin, such as metformin, many doctors say take metformin, the medicine, just after your meal. Some says before meal. What is your suggestion for a best outcome?
Metformin usually we
Whether
advise
it should be
after
taken
food.
before or after?
No, it should be after food to reduce the side effects of the medicine, because this medicine have some gastrointestinal tract side effects. So taking after food is better so that the patient will not suffer from the side effects much. The medicine which should be taken before
Fine. I
food
think I
is
have
the
covered almost.
sulfonylurea. The medicine which should be taken before food is sulfonylurea group, like diamicron, like amarin. This should be taken before.
Okay, sulfonylurea. Yeah. Yeah, I think I have covered all the questions, and you have also covered during your presentation. From my side, all questions are covered. Dr. Nitya, over to you.
So thank you, Dr. Velkul. Thank you for addressing all the questions and moderating it. Thank you, Dr. Hala, for the wonderful presentation. So we have now come to the end of the session. And before we end the session, I would like to inform about our upcoming OBEFIT webinar, which will be talking about calisthenics and aerobics for weight loss, which is in conjunction with today's presentation. As Dr. Hala mentioned during her presentation, that exercise is must. So, insight on this will be given by Dr. Madhurima Deshmukh, exercise specialist, and we look forward for the next OBFIT webinar. Thank you all. Thank you for your time. Thank you, Dr. Vilku. Thank you, Dr. Hala. Have a great day. Thank you.